A very good morning to everybody. On behalf of NIPID organizing team, IAP East Delhi, PIDA and IAP Delhi, a very warm welcome to all of you. This is the third edition of North India Pediatric Infectious Disease we are hosting, and we are overwhelmed to greet each one of you. This ID conference, this is a baby step towards educating ourselves, spread and share the knowledge. This will help to bring down burden of infectious diseases across India, IMR, NMR, and under 5 mortality in our country. Hope to have a great learning through this academic journey, and this is an opportunity to learn from eminent faculty from all over the country. Have a great time, happy learning, and enjoy the journey. Thank you very much. Now I request Dr. Ajay Gupta. He has been the pillar and the strength, and who actually started this North India Pediatric Conference way back in 2018, and we have come this far just because of him. So I request Dr. Ajay Gupta to say a few words.
Thank you, Dr. Puneet. Good morning. I thank our organizing team, all the delegates and all the faculty who made efforts to come in time. And I welcome our Delhi IP Secretary, Dr. Shamina, and Central IP Executive Board members, Dr. K.M. Adhikari, sir, and all the dignitaries to this gathering. And without wasting much time, we'll start the session in time. And I request Dr. Ajay Kumar to please begin the proceedings. Thank you.
So prevention is better than cure, and so are the vaccination at various stages of life. And this is the topic of our first session. It's a panel discussion being moderated by Dr. Arun Wadhwa, sir. Sir is consultant pediatrician in practice since 34 years and visiting consultant Rainbow Children Hospital. Okay.
Actually, we're already 10 minutes late.
Please keep everyone mobile on the silent mode. And sir is editor of IAP question answer book on vaccines and book on COVID vaccines. And welcome, sir. And our esteemed panelists are Dr. Vikram Bhaskar, Associate Professor, GTB Hospital. Please come. Dr. Aradhana Singh, Professor, GTB Hospital in UCMS. Dr. Kumar Ankur, HOD, neonatologist, BLK Max Super Specialty Hospital. Dr. Pankaj Nand Chaudhary, consultant Max Super Specialty Hospital, Vaishali. Dr. Sameer Dalwai is a developmental pediatrician from Bombay. And Dr. Gaurav Gupta, he has come from Mohali. He is EBCIAP 24-25. Thank you very much.
यहाँ पे दो टीम बन रही है, दिल्ली और नॉन दिल्ली टीम्स. ये 4 दिल्ली वाले, 2 बाहर वाले.
For chairing the session, For chairing the session, I would like to invite Dr. Sanjeev Mehta, sir, Senior Consultant, Kailash Hospital, and Dr. Vejna Dobal.
Thank you. Thank you so much. Thank you everyone for coming in so early. We always been talking about vaccination in childhood, but this time we thought we should talk about vaccination throughout life, and that is very important as we would learn as we go along today. We have to protect life at every stage. So, vaccination, as they said just now, is the second most effective, cost-effective measure after safe drinking water to prevent human deaths and reducing the mortality in last couple of years. It not only protects the individual, but also protects the community because of the herd effect. The others are also protected by an adequate number of people, children taking the vaccination. And as we know, we have eradicated smallpox, but it was like 45 years ago. Now we need to eradicate more diseases. Polio is almost out, but still we need to do much more. And as our public health system, as we see now, we have reached a good stage of infrastructure, cold chain, vaccine production, capacity, everything. And childhood vaccination is in place, kind of. But we need to expand this beyond infancy, and we must include adolescent and adults to reduce the disease burden in that age group, and also increasing the herd immunity so the children are also indirectly protected later on. And this is a new term which has come now, life course approach, and that is what the topic is today. LCA is to immunize persons, that all children, all people should receive all the recommended vaccines along the life course at different ages across different generations. So this is what the motto of next immunization century should be. So panelists, as they have just now introduced you, Dr. Kumar Ankur is there, Dr. Aradhana Singh. These two are from UCMS GTB here only, and Dr. P.N. Chaudhary is the only adult doctor amongst us. He's a physician in Max Vaishali. Dr. Gaurav is from Mohali, Dr. Samir is from Mumbai, and I'll be the student who will be asking them difficult questions. Okay. So when we talk of life course, I think we should start even before conception. So I think Dr. Kumar Ankur should be the right person to ask, because he's a practicing neonatologist in BL Kapoor. And which vaccines are a must? You know, when the mother gets, or the couple comes to you before getting pregnant, actually they would go to a gynecologist, but suppose the gynecologist refers the patient to you. What vaccines are must before you start a pregnancy?
Obviously, gynecologists won't send for vaccination advice. So obviously, when a mother comes for, they are planning for pregnancy, there are two components. One is that before pregnancy and during pregnancy. So before pregnancy, there are certain viral infections which is important, because they can lead to, lot of fetal malformation and as well as pregnancy losses. So out of all the viral infections, 4 and 5 viral infections are very important. We all know that measles, mumps, rubella, hepatitis B and chicken pox. And out of these 5 infections, the measles and mumps can lead to, maternal infection, sometimes maternal mortality in the range of, sometimes measles can lead to mortality up to 30%. However, they can lead to stillbirth, preterm delivery, and sometimes low birth weight. These 2 infections, measles, mumps, hepatitis B, they won't cause any fetal malformations. Rarely they would lead to fetal hydrops in some cases of mumps infections. However, the rubella and chickenpox, they are very dangerous, and they can lead to fetal malformations. We know that the rubella can lead to congenital rubella syndrome. They have all the triad syndrome. They don't not only lead to stillbirth and fetal death, but if the baby survives, they would lead to poor neurodevelopmental outcome if they survives. So that's why the rubella, varicella and hepatitis B, workup is needed before delivery. That's why it's important. And chickenpox, if mother infected with the chickenpox during the first 20 weeks of life, gestational age, they can lead to again fetal malformations. That's why it's very important to counsel the parent, mother. And even if they are not immunized immediately after pregnancy, the completion of pregnancy or delivery, they should be offered vaccinations.
So you should tell the gynecologist at least these 3 vaccines should be complete. And most of these young mothers coming these days, most of them have had all these vaccines. Maybe MMR 1 dose may be missing, so that should be completed before that. And then, do you think the husbands also accompanying the mothers, they need to get something vaccinated?
I think, sir, hepatitis B and
mainly the hepatitis
so
B.
And DPT is also infections, because that's important, because it's again a contagious disease. If the father is getting infected with pertussis infections, they can transmit to the mother, and they obviously.
So for cocooning strategy, we can advise him TDAP also, if the father is so interested in taking care of the child and getting vaccinated. What about now, moving on, the mother gets pregnant. These days, though parents get pregnant, though. What will you tell them? What is a must in pregnancy, and which all are given? Which times are they given?
So once the one mother conceives, then 3 vaccines are very important. That is one, DPT. The DPT, if the mother is immunized means mother has already received all the childhood vaccinations. They should be offered Tdap vaccines, and we can repeat the second dose after completion, after 4 weeks of interval. If the mother is not immunized, in that case, we should offer Tdap vaccines as soon as possible once the pregnancy is confirmed, and try to give second dose at least 2 weeks before delivery. And the second vaccine is flu vaccine, obviously the Indian Academy of Pediatrics and the WHO also recommends that mother should get flu vaccine because it has not only lead to the maternal infections but also fetal, sometimes fetal eye drops, and even neonatal flu infections can happen during the first 6 months of life. So they should be offered, inactivated flu vaccines during pregnancy as soon as the pregnancy is confirmed. And the RSV is the new one, WHO position paper 2025, they recommend that wherever the RSV vaccine is available, they should be offered between 32 to 36 weeks of pregnancy, because it not only prevent medically related severe lower respiratory tract infection in the mother, but also prevent neonatal infections during the first few months of the life. So if it is available, then we should offer during the antenatal workup. However, in India, it is still not available, sir.
So out of these, TDAP and RSV are mainly meant for the newborn to protect the child till the child becomes, takes the first vaccine of DPT, or for 6 months when RSV cannot be given. The monoclonal antibodies are the only solution. So they should be given later in pregnancy. Whereas flu is given for the mother herself, so because there is a 2.4 times increased incidence of flu during pregnancy, so the mother has to be protected. Although when you give later, the child also receives some protection for a couple of months, but flu is mainly for the mother herself. So I think then now, when we talk about once the child is born, and we can go on for one full day talking about childhood vaccination. Before that, Dr. Ankur, are you, or anybody else if wants to add up, can all vaccines can be given during lactation? The mother realizes that some certain vaccines, they were not given to her earlier. Now, you can take the opportunity of the mother coming to you with the newborn, which all